We don't have any initial public comment. We have a couple of, at least one public hearing, it looks like, later on in our agenda. But since we don't have any initial public comment or general public comment, we're going to go right into our coronavirus update with Katrina Rothenberger. Good morning, Katrina.
Good morning. Katrina Rothenberger, Public Health Division Director for Marion County Health and Human Services. As of today, July 29th, we have almost 2,500 total cases. We're at 2,495. This includes 2,399 positive tests, and we have had 27,930 negative tests, and 67 people have died. Yesterday, the governor released her plan for school reopening and the metrics that need to be met. So I was going to share what those are and what the data has been in Marion County. In order to go to an in-person or hybrid model for schools, we need to see 10 or fewer per 100,000 cases over 7 days, which in Marion County would be about 33 cases per week. And the test positivity rate would be 5% or less over 7 days. The transition to a comprehensive distance learning would be 20 or more per 100,000 cases over a 7-day period with a test positivity rate of 7.5%. And then comprehensive, which would be about 67 cases per week in Marion County. And then a comprehensive distance learning model is 30 or more per 100,000 cases over 7 days, and a 10% or greater positivity rate, which would be about 100 cases in Marion County. We do track this data over weekly over 7 days. July 6th through 12th, Marion County had 233 new cases and a positivity rate of 8.3%. July 13th through the 19th, we saw 267 new cases and a 7.8% positivity rate. And then July 20th through the 26th, 256 new cases and a 9% positivity rate. So we're still working alongside our school partners to ensure that when the time does come for in-person or hybrid instruction for our school children, that we're ready to be able to support them and work alongside if there's an outbreak or it's been a good relationship building exercise for us over the past several weeks. And so because schools aren't opening in the fall like we had anticipated, we're still maintaining those positive relationships and working with our schools for when the time comes. So, and then I just wanted to touch on masks and social distancing and all of the important public health tools, and just thank everyone for their diligent mask wearing and encouraging everyone to wear a mask over their mouth and nose. And, just even if you don't think you need to wear one, wearing one and creating some good positive social norming around mask wearing will really help encourage others to also wear masks. So, and even acknowledging people's good mask wearing behavior and social distancing, I think, can go a long way. Nobody wants to be shamed into wearing a mask or social distancing, and we know that these are the tools that we have currently in our toolbox to help us keep COVID at bay in Marion County. So thank you, and encouraging everyone to continue those positive health behaviors.
Thank you, Katrina. Mr. Cameron, I just want to say I really appreciate your mask wearing. I think you're creating some very good positive social norms here in Marion County.
Thank you. I like the little curly parts. That's what happens when you get a homemade mask.
Any questions for Katrina?
I do.
Please.
But one I've probably asked about 3 dozen times, but I still don't really know the answer. So when do people come off the list as cases? Because I don't think we have any procedure that inquires or certifies or whatever that they're done with it. But how do you keep that part of the number pure?
Yeah, what we have been doing is just reporting new cases in the past 14 days. So that can be a good proxy for the number of active cases in your community. So after 10 days, people are can discontinue isolation and quarantine. So the number of new cases in a 14-day period is kind of a good way to assess, how much is currently in your community of like active
But it
disease.
isn't an accurate number ever on how many people are dealing with it at a current
That's
point in
correct.
time.
That's the number that we know about. I actually did want to share that it's really great that all these businesses and workplaces are doing health screenings and temperature screenings for employees, but we have seen asymptomatic people going to work testing positive for COVID. And for example, this was in a fire agency and they had to quarantine over a dozen firefighters. And this person also spread to a household member as well. So that's why we're also really encouraging masks, because you could pass your health screening just fine and still pass it on to folks around you. So it's super, super important.
So then the other question, kind of not related too much, but one of the governor's criteria was this test positivity, you called it. And I've never really bought that number because it's an easily manipulated, if you wanted to, by just testing. If you test a random sample of people, you'll get under that number. If you test those that are showing a whole bunch of symptoms, obviously the number will be too high. So I think it's an invalid number, and I'm sorry they chose that.
Yeah. We're really trying to test people who we think need tested and have COVID, because we want them to get the best treatment possible if they need it, right? And to be able to isolate and quarantine and further prevent the spread. But you're right. When we don't have comprehensive testing of everyone, that number is a little.
Yeah, if everybody was tested, it would be a valid number. But if you just test those that showed pretty definite signs, can't be low. It shouldn't be low. That's all.
I did wish that the governor had been kind of allowed more flexibility, I think when I heard the metrics, Marion County hasn't met those metrics since the beginning of the pandemic. So she could have just said, the Salem Kaiser School District or Marion County is not opening, because to kind of make it seem as if there are these metrics that are attainable, but, most counties in the state have never met, is sort of a strange way to go about, making the decision not to open schools. And I think not all schools are the same, so this is one of those things that we dealt with the business situation, businesses reopening, is, a school with 2,000 people has a much harder time social distancing than a school with 50 people, for instance, right? And so I think I wish, and I think I'm going to be kind of advocating for this, that they really look at it not necessarily region by region, but sort of school by school, and say, well, wait a second, if, a church can meet with 25 people, or a business office can meet with 25 people, certainly a school should be able to meet with 25 people or 50 people, if they're a smaller school. So it did feel a little bit like a one-size-fits-all solution.
Mm-hmm. Yeah, I think you make a good point about cohorting. Cohorting is really important to keep the virus at bay too. That helps us with our contact tracing and identify outbreaks. And I also have been looking at this information by zip code, and I was looking at the 2-week numbers. I don't think that there's a zip code that would actually meet those metrics either, but you did make a point around the size of the school. So
Right. Well, because and this is what we dealt with when we were trying to reopen businesses, is if certain situation is safe with a certain number of people in a certain distance, that should be the case for all similar activities. We shouldn't say, oh, you're this kind of a business, so you get special treatment, or you're that kind of business, so we don't treat you the same way. I think it should be the same way with schools. Certain group of people of a certain size with a certain distance, the health risks are the same.
yeah, I think it would take some advocacy, and we could certainly work on that, because we know how important school instruction is to our children and families. And also, we have asked our GIS person to look at school catchment areas as well and kind of break down the data that way. So we could have some data to potentially make an argument there.
Thank you.
Mm-hmm.
Anything?
I was looking for something that somebody sent me yesterday that had hospital deaths in the state, number of hospital deaths in the state versus hospital deaths of COVID. The normal hospital deaths have gone way down relative to COVID deaths. And I thought that was very interesting. How many deaths are being tacked with COVID at some point in time, right? I can't find it. I'll have to, I was just trying to do a Google search to see if I can find it. But it was an interesting number that almost like cases were being moved from regular to here. I'll find it, but
Yeah,
if you,
please, I'd be interested to see it.
yeah, if you find
you.
it,
Okay.
I'll send it to you. It may have been a dream I had last night. I had a rough night sleeping, so we'll see.
It all runs together nowadays.
It is.
That rebreathed air in the mask is causing,
Is that-
I'm pretty sure.
That's what it is.
Okay, thank you, Katrina.
Thank you.
I appreciate it.